Currently, there is no limit on the number of patients that can be assigned to a nurse at one time, except in the intensive care units. When RNs have too many patients to care for at one time, bad things happen. Patients suffer the consequences, including the highest readmission rates in the country. Establishing a maximum limit on the number of patients that could be assigned to a registered nurse would make the quality of patient care in hospitals better. The pendulum has swung too far, and decisions by hospital executives spread nurses too thin, with high patient assignments negatively impacting care. A survey conducted this month of frontline RNs, more than half of whom are not members of the Massachusetts Nurses Association, found the following impacts to patient care. Again, this is what RNs on the front lines are telling us about the impact on care on your constituents. RNs report that requiring nurses to care for too many patients at one time harms patients, and the problem is getting worse. 77% of RNs report medication errors due to unsafe patient assignments.
Absolutely.
72% of RNs report readmissions of patients. 66% of RNs report longer hospital stays for patients. 64% of RNs report injury and harm to patients due to unsafe patient assignments. 36% of RNs report patient deaths directly attributable to having too many patients at one time. In each of these categories, RNs reported an increase over 2017. RNs report that due to caring for too many patients at one time, they do not have time to attend to the needs of their patients. 86% report that RNs do not have the time to educate their patients and provide adequate discharge planning. 90% report RNs do not have time to properly comfort and care for patients and families due to unsafe patient assignments. Please note that these two data points are key indicators to high readmission rates. Patients are sicker than ever, and nurse staffing has gotten worse. 81% report patients are sicker than they were 10 years ago. 35% report RN staffing has gotten worse over the last 4 years. Only 21% reported improvement. Nurses universally agree on the solution to this patient safety crisis, a law establishing safe patient limits. 86% of nurses surveyed support the Patient Safety Act, a ballot measure that would establish safe patient limits for nurses in all hospitals based on the needs of patients. Decisions on patient assignments today aren't made by the RNs on the hospital floor. They're made by far-removed hospital executives. In fact, as part of this survey, the vast majority of RNs responded that when they have too many patients to care for, the hospital executives provide little help to adjust their patient assignment. Nurses like me that are on the front line are telling you that their patients, your constituents, are not getting the care that they need because of high patient assignments, and something needs to change. Nurses say that the change patient needs is safe patient limits. Thank you.
Thank you so much, Kelly.